Welcome to the Fit Drivers Podcast, sponsored by 10th Street, connecting carriers and drivers to make life easier, pre and post-hire. From efficient and seamless recruiting to tools that keep drivers engaged and compliant and on the road. 10th Street helps you market, hire, retain, and grow. Learn more at 10thstreet.com. Okay, everybody, welcome to Fit Drivers Podcast. Thank you so much. And Fit Drivers Podcast, we're very lucky to have 10th Street be our sponsor. They allow us to get out here and talk to the communities and carriers and drivers and everyone, HR folks, about the driver health epidemic that's going on. And so last year or so, I spent talking about the numbers and how devastating the statistics are. And these first few months, I've been bringing on companies that have solutions. And so I'm really excited today, a new company that I've had a chance to be associated with called Nudj Health. And today you're going to hear from Deb Halligan. Deb is the Chief Clinical Officer for Nudj Health. She brings 23 years of in-hospital nursing experience ranging from critical care. She also was an early adapter to remote patient monitoring in cardiac devices, which led to her publications in EP Lab Digest and presentations at Heart Rhythm Society. She was joined by an executive team at Geneva Health Solutions. They scaled, this is pretty interesting, the remote monitoring business from 8,000 patients to 90,000 patients. So we're in for a real treat today to hear from Deb. Deb, thank you so much for being on. Looking forward to it.
Thank you, Bob. Thanks for having me today.
You bet. So before we dive into it, in my conversations with Deb, she's got a pretty interesting story. I asked her to take a few minutes and tell about her young experience driving across country that I believe it was your father that gave you this advice. So go ahead, Deb, tell the listeners.
Yes. So back in the 90s, I was a traveling nurse. So I traveled all over the country. And as you know, that was before GPS and smartphones. My dad gave me a great piece of advice, and he said, stay with the truckers. So if you encounter weather or anything, just stay with the truckers. They know what they're doing. And that literally saved my life because we came across a horrible black ice storm. And because we stayed with the truckers, we saw everybody slowing down. We knew something was happening. We were able to get off the highway safely before there were several jackknives and several accidents. So I'm still around today thanks to the CDL world.
Oh, right on. Great story. Great story. I was telling your colleagues the other day, I don't know I think you had to jump off for another call, but people don't realize that professional drivers, they really started social media way back in the day, right? Before there was Facebook and all that, they had the CB radio, and that's how they navigated. And I never forgot that as a young boy riding down the road with my dad, and he'd get on the radio and say, "Hey, I need some new tires," and within seconds, they'd be responding back, "Go here, don't go there. If you go there, tell them Joe sent you," or whatever, and that's how I never forgot that information, growing up and applying in business. And then all of a sudden, Facebook came alive and everybody thought, wow, this is the greatest thing going, right? Well, I just wish that in the trucking world way back in the day, there had been somebody sophisticated enough or had the money or whatever to really give the drivers that experience and them start that cadence. But anyway, it didn't happen. Okay, Deb. So listen, I was very fascinated to hear about Nudj Health, and I want you to take a few minutes for the listeners and tell us about your model, really what Nudj Health is all about.
Yes, thank you. So Nudj Health is a virtual service that delivers whole person care utilizing lifestyle medicine interventions. So I know that's a lot of words, but basically what that means is lifestyle is how we think, how we feel, how we eat, how we exercise, how we sleep, how strong our social connections are. And 80% of chronic disease is based in our lifestyle choices. So we work with patients in each of these pillars, depending on where they want to start. And so we work with patients in stress management, nutrition, physical activity, sleep, social connection, and high-risk behaviors such as drug and alcohol consumption. So with, just like in the United States, we're sick. We have a lot of chronic disease, but then you take it to the CDL level and it's much more. So when I talk about chronic conditions, I'm talking about high blood pressure, type 2 diabetes, heart disease, obesity, and a lot of this can be avoided or reversed through lifestyle interventions.
Very good. So, you and I have talked. I've sent you and your colleagues, the current state of the driver's health, based on information from FMCSA and DOT cards and how many we have out there. The alarming number that's about 55 to 60% of our drivers are operating on short-term cards, meaning that's probably anywhere from 8 months to 3 months that they have to operate. So, and you saw the number of what it relates to as far as blood pressure, sugar, and some things you just talked about. So tell me, in your experience, when you look at that profile of a professional driver, what does that look like in your world today when you're talking about the average consumer out there that you're helping at ABC Company or whoever you're working with?
Well, this is exactly the population that we're targeting. So when we look at the CDL population relatively compared to the US population, their numbers are much higher when it comes to chronic disease such as diabetes, obesity. But that is exactly the target population that we're working with, because our goal is to reduce the burden of chronic disease, improve patients' quality of life, or customers' quality of life, improve the overall health, and help people come off medications, and also learn to know that they are in control. So a lot of what we deal with in our healthcare system today is I call it the 3 Ps: pills, procedures, and pamphlets. And we're very used to the quick fix of pills and procedures, but that does not change the root cause of the disease. The root cause, as I said earlier, 80% of chronic disease is based in lifestyle choices. So if we can help people make small, sustainable changes and build on those over time, they're going to eventually improve or reverse their chronic conditions.
So, and I'm always amazed, and when I talk to people a lot about this, that we know that, America itself suffers from a lot of these same issues, right? The difference is the general population, as I always talk about, they have the ability to go get treatment, right?
Right.
And see somebody. In the life and the day of the professional driver, that always not be the case, that they can get care. So how do you see Nudj Health being able to help and support this mobile population? Because they're all over the country, right? And this is something else a lot of people aren't aware of, is that probably 90, that's number I looked at to give the best estimate. It's close to 90% of the drivers out there don't really have a provider, right? A personal provider. Their last doctor was the last DOT doctor they
Mm-hmm.
saw, right? And that might be one that they see once in their driving career. Maybe some go back to the same clinic not very often. So take a few minutes and tell me and the audience about how can Nudj really help service this mobile population? What makes you different? Because I know there's some of the healthcare companies out there, and this is what I really want to get across to everybody: the differentiator Nudj brings to the table. Because there's a lot of healthcare companies that say, "Hey, we got Daladoc, DocOns, or all those different ones, right?" Which is really a network of doctors, and they all claim it's their exclusive network, and that's not really the case. But anyway, so what makes Nudj different?
Well, a couple of things. One, we're virtual, so we can work with your mobile population as long as they have a smartphone. Most of our appointments can be done talking on the phone. So we do a mixture of one-on-one and group classes. So the one-on-one is where you work with your health coach or your care manager to implement and assess the changes that they're making to get to their outcome goal. So all of that can be done on the phone. The only time we ask that someone is actually on camera is if we're doing a fitness assessment with them. So we need to see how they're moving. So this would fit in really well with this population because they can be driving, they can pull over to a rest stop. It's all mobile as long as they have, connection, cell phone connection, Wi-Fi, they're good. That's one thing that makes us different. The other thing is that we're working with patients or customers across time, right? So when we think of behavior change, can't be done overnight. I always go back to New Year's resolutions. How busy, I always look at the gym that first week or couple of weeks in January and you can't even get in there. But just wait 2 weeks and you lose about 50% of the people. And then you wait another month and you lose another 50% of that. And only about 10% of people actually can make those changes. And the reason why people are not successful is because as humans, we try to make too many changes at once. So at Nudj, we are working side by side with our customers to help them. So we're meeting them where they're at. We are creating customized goals and a customized program that is patient centric to allow them to meet their goals. So when you're talking about seeing, doctors are wonderful, but they're there really to prescribe. They're not there to work with you to coach you through change.
Got it. So, question about let's say, somebody I'm a driver, and we're fortunate enough to have Nudj as our support in health and wellness, and I'm out there on the road and I'm having some issues, and I need to talk to somebody. So, and am I able to get instant contact? I mean, call up and say, Bob, hang on, we're gonna get somebody on the line for you. Or is it a process where you have to wait and we'll get you back to you and it may be the next day or whatever? What happens?
So once you're an established patient or customer of Nudj, you will be given all of the contact information of your care team. So because the care team will be working with other people, you might have to wait a little bit to hear from them, but they usually get back to you within the same day. When our team meets with a patient, they set up all the appointments for that following month. So you get three appointments per month, one-on-one, two group classes, but you have that ability to connect with your primary either health coach or care manager through email, phone, text at any time. They'll just get back to you probably within a few hours.
Okay. So, I wanted to talk about this, and you brought this up about, talking to the patients about, it doesn't happen overnight, it happens over time, right? And that's what I've really love about working in the DOT driver population space. And I always refer to people out that are not drivers in the residential space, and it's the reason why I made a decision years and years ago to move out of that arena, because if they don't look like everybody in the magazine in 30 days, they quit. Right. And just like you're using the example, the health club opens, right? It's very interesting because in the driver, those numbers kind of mirror when I think I was sharing with you and your colleagues, when they hire in, hundreds of drivers a month, in that first 30 days, it's like huge fallout, it's 60, 70% fallout, right? And so a lot has to do with help keeping those people. Obviously it's not for everybody and they find that out pretty quickly, but also too, a lot of it is challenging for people with their health. But what I want to get back to, what I enjoy about this, and you will find out as a health professional, we always, right, we're interested more in what we can do to help change the numbers inside you. We're not plugged into how great, Bob's going to look in 30 days and, all that. We're trying to make sure that your internal engine is functioning properly so that you can be productive and be alert and be safe. And then, over time, if you follow that, and over time, in 6 months, you look in the mirror and go, oh my gosh, you see a physical difference. And that's what I love about working with drivers, is because their main number one goal is that they want to go into that clinic and walk out with that certificate that allows them to continue to drive, to take care of and provide for their family. And those are based around not what you look like or how good a shape you're in. It's based around, your biometric readings and so forth, your sugar, your blood pressure, all those kind of things. So I think I just wanted to put that in there because you will get, and your team, I'm sure, will be very interested and pleased to be able to finally work with a population that's more interested in what's going on inside their body instead of so much on the outside. But
Well,
so tell me, go ahead.
now just, going back to what you were saying about, that feedback loop, right? Like wanting to look a certain way and that taking a long time. That's one of the things we work with our customers on, is that we show them other ways to find, satisfaction that it's working, you know, increased energy, better mood. And each of these lifestyles are interconnected. So if you start working in nutrition and you might have some mild depression, anxiety, guess what? That's going to get better because there's a connection between what you eat and your mood. So while you're working in just one lifestyle, you're actually improving all of the lifestyles. So I just wanted to add that.
No, a good point. And that's I'm glad you did. It's a great lead into my next question, which is, and once again, I've showed you the statistics and the thousands and almost millions of drivers that are operating on short-term cards. And that would be probably the first approach in working with some carriers and say, listen, we've got a model and we're going to help you save your drivers. So as you and I have talked about that. So what would your way of process be that a company, you get a contract with ABC Freight and they say, okay, we want to see some movement. And because one of the best things that you're really good at doing is taking that stable population and help move the needle on them, right? Because they have all these other chronic issues and you're helping them correct those, identify those and correct them and get attention for them. But the first, I should say, I guess, lack of better words, low hanging fruit for these companies is if they had, say, I got 100 drivers that have short term cards, Deb, I need to get them coached up. I need to get them prepared within the next 90 days to go back in and get that recertification and hopefully get that 1 year card so they can continue to work. And then we can start working on their other health issues. So what would be a plan of attack for Nudj to be able to help that population do that?
Well, that's the wonderful thing about making these changes, is that you can actually start to see improvements in blood sugar, blood pressure, in and your lipids in 2 weeks. Just 2 weeks of making small changes. So if we can get that out to your population and help them make those small changes and stay with them for those 90 days, they're going to be getting their one year license. And then during that time, we can really start to expand into going deeper. So we would work with the patients to meet those short-term goals to get that license in that 90 days. And then my hope is that they would stay with us and go through each of the lifestyles that they need to improve each of the areas.
Want to mention, and we can make this available later on, but one of the things that Nudge does offer, you offer co-branding marketing materials. Is that correct?
We
That the
do.
companies can put up in their drivers' lounges or use it to post on social media for their network, right? They can co-brand it for Nudge and ABC Health and make it tailored so it can fit the professional driver lifestyle.
Absolutely. So that's part of our onboarding process, is we, gather everybody's, um, all of their marketing materials. We co-brand. We can call the program whatever it is that the company wants to call it. We have, risk reduction. We have lifestyle medicine. So all of that is determined during the onboarding process. We would create posters, handouts, social media, anything that you need from a marketing perspective, and brand it together.
But do you do text messaging as well to the employee? Can they receive text messages?
That
Okay.
text,
Yeah.
email, all of it.
So one last question here before we wrap up. Uh, Give me an example, and the listeners an example of Nudge's success, a company that you've really got some hard data from, that you were with helping them for whatever the period of time is, and you really showed how you moved the needle for their company. Do you have an example you can share?
I do. I'll give you some statistics and then I'll give you a quick patient story. So, in 16 weeks, we're seeing improvement in depression and anxiety scores by over 50%. And to give you some perspective, that's typically seen with traditional psychotherapy. It takes 87 weeks. So, our approach is working. Our patients are losing 5 to 14% of their body weight. Their fitness is increasing by 54%. So they're meeting the American Heart Association recommendations of movement of 150 minutes per week. We can work with this population on how they would do that because, they are sedentary. So, how do we get that in per day? Our sleep patients are improving their sleep by 41%. And then blood pressure improvement by 24%, cholesterol decreases by 15%, blood sugars by 20%. And that's in a 16-week time. So we're looking at 4 months to get those very impressive changes. One particular patient does come to mind, though. He's a 65-year-old man who suffered from obesity, high blood pressure, shortness of breath. And he was actually facing bone spur surgery due to his weight. When he started with us, he could barely do 5 minutes on the treadmill. And by the 16 weeks, he had lost 40 pounds. He's able to walk 40 minutes a day on the treadmill without any issues. And shortness of breath went away. And guess what? He didn't need surgery.
Ah, great, great. Good story. Good story. Well, Deb, when we close up here, so tell the listeners, how can they find Nudge and learn more about Nudj Health?
Okay. So we have a website, just nudjhealth.com. And it's Nudj with a J, so nudjhealth.com. They can email us at patients@nudjhealth.com, and they can also call us at 833-411-6835.
Well, Deb, thank you so much. This has been great. Really good information. I really appreciate folks when they come on and they deliver solid solutions, right? Because all the people that are in the VP of and safety and human resources, all that, they all know it's a problem, right? But they need to know how we can fix it. So, and recruiting is a huge issue. It's a big cost. So I always talk to them about why not invest in the driver today before you hire the next unknown driver tomorrow, and that Sally or Joe or whatever has been with you for a couple of years. Why not? And they got a good driving record. Why not invest a few $100s to save them instead of spending a few thousand to bring on Bob, who you don't know, and chances are he won't stay, right? So it's good. Deb, thank you. You're a real champ, and I appreciate all the good work you do out there saving lives every day. So much appreciated.
I appreciate it. Have a great day.
All right. You too. See you soon.
Welcome to the Fit Drivers Podcast, sponsored by 10th Street, connecting carriers and drivers to make life easier, pre and post-hire. From efficient and seamless recruiting to tools that keep drivers engaged and compliant and on the road. 10th Street helps you market, hire, retain, and grow. Learn more at 10thstreet.com.